setting new standards in podcast excellence. You have joined the WBT, fully focused on business and taxes. Here is your host, Michael Lodge.
And welcome to the WBT. This is Michael Lodge. I'm glad you're with me. All this morning, I was woken up by thunder and lightning, and it shook the house. I tell you, Mother Nature really spoke the last few hours. So what is the conversation going to be about? Well, it's going to be about the whole Corona thing. How it's disrupted our lives, how it's disrupted and killed businesses, and how we made some really bad decisions based on bad data. I'll be with you in just a few seconds. With every crisis, there comes conflict. So if your business is having a conflict or a dispute, contact me. I'm a certified mediator. Send me a text at 818-252-5682.
Business and taxes on WBT.
Now I'm going to give you fair warning here. If you hear me pause, it's because I have been underneath a house in South Carolina all last week and up in the attic, and I have been breathing in all this dust particles and insulation and everything else that went into my lungs as I was down under the crawl space and up in the attic and outside and everything. It got to me. So it's affecting my lungs at the moment, making me want to cough because I'm trying to get all this stuff out of my lungs. I tell you, I'm so thankful that I work as an accountant and as a tax guy and as a certified mediator, because I don't think I could. I'm very proud of you guys out there in the construction industry. You guys you got stamina. I'm an office guy. I don't have any stamina, even though I got it done, got everything done that I need to do. But I tell you, I had no fun at it. It was no fun whatsoever. But it all got done. But it's now I'm back here in South Florida, and we've had some really bad thunderstorms this morning, and the rain came pouring down. But now we've got blue skies out. Amazing, right? Storm and then blue skies, and then probably this evening it will probably cloud over again, and we'll have some more rain, and we'll see what's going to happen out there. So let's talk just a little bit about what's happened with this coronavirus thing. I was reading an article this morning about doctors up in Northern California. Now, I love Northern California. It's the most beautiful place on earth. It's better than Disneyland. It's just beautiful. But the doctors up in Northern California are saying they have seen more deaths from suicide than they have seen from coronavirus during the pandemic. They have seen more suicides than those people dying from, or patients that have been affected or have passed away from corona. They said, one doctor said that the numbers are unprecedented. Dr. Michael deBoisblanc, now this is a really difficult name, okay? deBoisblanc of John Nuir Medical Center in Walnut Creek, California. He told in an interview with ABC 7 News about the increased deaths by suicide, adding that he's seen a year's worth of suicides in the last 4 weeks alone. This is caused, and we've seen this happen not only in Northern California, but throughout California and throughout many states. And I'm here in South Florida, And we've seen an increase in suicides here. We've seen an increase in suicides, an increase of drug overdoses, an increase of assault and battery in the home. We have seen mental health patients not being able to talk to their mental health counselors because they can't get a hold of them because everybody's off in remote sites or might be home working. So we've seen this. We've seen this increase, and it's because when you are locked down, when you are in confinement, your whole life changes. Not for the good, but for the bad. People are social creatures. We're meant to be out there communicating and working and laughing and giggling and crying and everything else with people. Not with our dogs. I have had to look at my dogs for so many weeks now that I don't think they even want to look at me anymore. They're talking about me behind my back. I know they are. Oh my God, that's a mental health issue. But that's the issue, is that when people are confined alone or with a group of people and they can't be close to each other, because if you've read the study that was done out of New York, those in confinement were 66% of the people going into the hospitals because they were infected by corona. So being in the lockdown did not save them whatsoever from that virus. That virus spreads like any other virus, a flu virus, whatever the virus is. It floats, it moves, it keeps going. And there's only things that correct that virus is the temperatures or we taking better vitamins and taking better health care of our own bodies. And there's a whole bunch of things that can help us get through all of these viruses. I think I mentioned the other day, I have not had the flu since I was a kid. That's a long time. But when I grew up as a kid, I was in flu city. Seattle, when I was growing up, we had so much flu. We had the Hong Kong flu, we had the Chinese flu, we had all of these flus floating in. And sometimes we were laid out in our bed for 2 and 3 weeks at a time trying to recover from this stuff. But we never shut down the nation because of it. And sometimes I felt like I was on death's door when I was a kid, wondering if I was going to make it through. And that was in my little tiny mind at that time. But we never shut down. After 3 weeks, we were looking forward to getting back to school. But that happens when we have a lockdown. When you are confined to anywhere, it begins to affect you mentally. Now, we got locked down. We went into confinement because state governors, local officials were getting bad data. And sometimes even though that they knew that they were getting bad data, then it became a political issue. And let me tell you, when people are sick, it should never be a political issue. When people are losing their work, they're losing their companies, they're losing their small business or cutting hair or doing nails or whatever you were doing as a business person, when you lose that based on bad data, you have to hold people responsible for that. We have had so much bad data from the very beginning of this, with the CDC and other government individuals. They were taking information from other countries who were getting hit hard. Remember, Italy was getting hit hard. China was getting hit hard. South Korea was getting hit hard. So they were taking this data in from all of these other countries on how they were handling it, but it was bad data. If a person had a heart attack, they were counting them as a coronavirus death. And then that's happening right now in the state, in all of these states. We're getting bad data. We have overinflated the amount of people who have gotten sick and overinflated the people who have died from this virus. And we have mismanaged, states have mismanaged the way that they handled these patients and how they distributed them to various facilities. But we had bad data. And even now, states are going back and they're looking at the data and how people were counted as a coronavirus death, and the numbers have come down in those states who have begun to count. The part of that bad data is that, and I blame this on the states and local government, especially the states. Every single state has a Department of Health. Or they might call it something different, but that's what they function as, is a Department of Health. These departments, they go out and they license hospitals, they do surveys on hospitals to make sure that they're operating properly and safely, and they collect data. The problem with the state's computer systems is that they are so antiquated, so out of date, that the programs that are running some of this collection of data can't do it correctly, because there are people who have left the state agencies or companies who were in charge of programming and keeping updated programs on this data. So they've hired outside consultants to come in, and these consultants are having problems with the individuals within the states that run these computer programs and data collection divisions, because they've been there so many years. And they don't want anybody coming from outside telling them what to do, even though that their systems are so antiquated. And a lot of these people have no college degrees or no training whatsoever. They've picked up programming along the way. So they're trying to bring in these new software systems to get better data, but the internal politics of some of these departments are creating a hang-up. And that's where we don't have good data. Because the data that's being collected now cannot communicate with anybody else, because the state's programs are so old. So it takes really good programmers to go in, analyze the situation and what's going on, and how they're collecting the data, and how the programs are running, and how they're measuring things, that it takes a while for those outside people to understand what's going on. But once they get in there and they begin to start suggesting changes that need to happen, they are fought by these old people who have been there so long. They're not willing to give up their power, because they worked up that power without having any kind of degree or any kind of knowledge. But they've worked it up. They've worked their way up through the state systems. I have a client that went to Vermont, and that was the situation. Same thing in California. There's a mandate under Obamacare that said that all hospitals and skilled nursing facilities needed to be up and running on a new program where you can collect data very easily. But still has not gotten to that point. They're still struggling on that situation. So what do we do? Well, whatever data that is coming in to make policy, especially regarding the coronavirus, it's kind of like a pole that goes up and down on a daily basis, and it's not driven by good questions or good data governs. Everybody's doing it differently, reporting it differently, looking at it differently. There was a situation in California, where one of my clients went in there to help them design this new mental health database. And the first thing that you always look at when in the design process of a database is the legality of the database. In other words, who's going to take responsibility in case there is a breach or in case there is a bad data, or if the system has an issue or has been hacked or anything else, who is going to take the legal responsibility of that? And they found out that no attorneys had looked at it. Nothing was done. They were designing this mental health database system where doctors and hospitals and medication and pharmacies were all going to be talking to each other, but no one looked at the legality of what they were doing. That's a big deal. But that's what happens because you've got individuals in these systems, these old antiquated systems, that they don't think about the legalities because they didn't have to do that when they first set their systems up. No one looked at that. No one was that crazy at that time. So the collection of data is compromised because of the legality issues. It's compromised because there were individuals in place who do not understand how to analyze the data or look at the data or to collect the right data. There are systems in place that are so antiquated that the data gets all confused. And no one knows how to go in there and fix it. But they keep reporting the same bad data. So a lot of this information was going up through to the CDC. And now we find out that even at the CDC level, on the collection and analysis of data, they were mixing data. He just admitted that 2 days ago. Now, on this data, you had a president making decisions, you had governors making decisions, you had local government officials making decisions based on bad data, but then it became a political issue. Bad data is worthless. Bad data in, bad data out, bad policies made. And the policies that were made was to shut down the nation. And the first state that did it was Gavin Newsom out of California. He was the first one to decide to shut down his state. And then all of the other states began to follow. And Governor Newsom still feels that he needs to shut down his state. While other states are beginning to open up because now they're looking at and they're analyzing data. Because every spot in the nation is different. You just can't say, we're going to set one set of rules for California and that's going to be it. No. Every part of that state is different. Different types of people living there, different health habits, all kinds of different information. So you can't just take one policy and shut down the whole United States. I was pleased to hear this morning on Twitter, I guess I saw it on Twitter, that the president said that if this were to ever happen again in the United States, he would not shut down the United States. So based on bad data, we destroyed businesses. We destroyed individual homes. We destroyed the mental health state of many Americans. We increased the number of suicides. We increased the number of overdoses on drugs. We increased the amount of people being abused at home. We increased all of these bad situations based on bad data. And one of the issues that we're having to deal with now is the issue of companies closing down. going out of business based on bad data. Now, we need to hold politicians, city managers, governors, members of state legislative bodies. They need to be held accountable for the decisions that they made, for the businesses that they killed, for the jobs that they killed, for the increase in suicide, for the increase in all of these negative outcomes from being shut down, put in quarantine, locked down. And the mainstream media went on and on and on, and even to this day, they're still going on and on and on about how you have to do this and that and this and that. And they have all of these rules, but they have no solutions on how to make individual lives better and how to bring back business. But they've got a whole bunch of rules to tell you and me on how to live our lives through this virus. Now, CDC said 2 days ago also that this virus is very low possibility of you catching it from it being on the surface. Very low. Now, what were we told? We were told by everybody in state governments, make sure that you're cleaning every single thing. So all of these businesses began putting up dividers and everything else, which did nothing. And then we saw 66% of New Yorkers that were in quarantine, that were locked down, were the ones going to the hospital. A huge number. So lockdown failed at containing a virus in New York. This is a virus. It's going to be everywhere. No matter if you're wearing a mask, no matter whether or not if you're taking super duper precautions, it's still going to be there. And it has a life of its own. It's going to come in weak, get very strong, and then slow it down. But we had Dr. Fauci, and we had all of these people from the CDC telling us we need to do this and that. And then we find out, well, we really didn't need to do this and that. But based upon what they said, and based upon what they said their data was, which was bad data, all of these state governors took action. And they shut down their country. They shut down their state, their communities, their schools. Everything died because they based their decision on bad data. Now, is the data any better today? I have no idea. Have they focused on their systems to make sure that they're bringing in good data or collecting the right data? Don't know. I know the CDC isn't, because they mix their data together. So the question has got to be asked, what are we going to do about the collection of information about infectious diseases and how it's affecting various communities? How are we going to have good data? And it's consistency. It's about having a standard that everybody follows, and that has got to come from the federal government. They've got to sit down, not with government officials, but with medical people who are out there every single day, who are looking at patients, who are looking at data, and making healthcare decisions based upon what they're seeing and not by what they're hearing or what they're reading. And you know there's been fights over what medications work and what doesn't. That's a non-stop fight, because now it's become political, because they want to point fingers at the president because he's taking a certain drug. We cannot make our healthcare political. We have got to make this so that it works. And I bring this up to you. Do you really want the government or a state, the federal government or the state government, running your healthcare? Based upon what I've seen with this epidemic, no way in hell. No way in hell. They can't even control their data. And people jumped to conclusions, and they jumped all over the place, trying to make themselves like they're really acting to do something. But they were doing things that harmed Americans all over this great country of ours. And other governments around the world did the exact same thing. There were some smart ones that just kept the economy open and kept going on. Better results. So we're at the point now where we have companies failing. They're going into bankruptcy. They're closing down stores. Not just 1 or 2 stores, 250 some stores all at one time. So, bad data is an evil thing, I tell you. Listen, I'm an accountant, so I look at financial data all day long, 7 days a week sometimes. And I begin to look at that and I begin to spot things that I don't agree with. And I begin asking questions. I don't make any decisions yet. I'm not making any decisions until I've asked the questions that I need to ask on what's going to happen if this data changes. Where did this data come from? How did you assemble your data? How much analysis did you look at your data? Did you test your data? I'm not going to make any decisions until I know exactly what happened with that data and how it got to me. It's exactly what these governors should have done, is that they should have continued on. Put some preliminary health precautions in place, masks, distancing, whatever they felt. But closing down and putting people into a quarantine or a lockdown situation did greater damage than the virus itself. And we're seeing that every single day. What I was really upset about is the amount of money that we spent on this hospital in Los Angeles, St. Vincent's, I believe. They opened it back up. They spent $15 million to get it into shape so that they could cover the coronavirus. Do you know how many patients they saw? 65. $15 million and they had 65. We really did a bad thing. We relied upon a bunch of information that was bad. It was corrupted. It was dirty. And we destroyed the nation because of it. Sad. So I encourage the president, get a handle on your data. Governors, get your systems up to speed. You've got antiquated systems in place that are disgusting. They're collecting bad data. They're providing you with bad data to make decisions in your communities. So, Mr. President and the governors, I speak to you from the heart. And I ask, do better. Sit down together. Send your medical professionals to Washington, D.C. and begin working on a method of collecting good data. Never again should we be shut down because of something like this. This has done so much damage to many states, many businesses, many people. And then we threw trillions of dollars at something that was based on bad data. And then Pelosi wanted to spend another $3 trillion on something based on bad data. And then she put in a whole bunch of rotten old bacon in there. Her pork barrel. And played politics. So you and I, we've got to ask, is our government really working for us? Are they protecting us? And based upon what I have seen with this virus in all of these states, the states were unprepared to handle any type of crisis whatsoever. So, Mr. President, governors, legislators, mayors, city managers, county commissioners, whoever you may be, You have a responsibility to your constituents and to the people of your states to do better. Because what you have shown us in this pandemic is that you cannot handle a crisis. This is Mike Lodge for the WBT. I hope everybody goes out and has a really great weekend. This is Friday as I'm recording this. I hope everybody goes out and has a really good weekend and enjoy the time with their families. Get out and walk. Go to the beach. Walk around the lake. Do whatever you have to do to get out there and live your life. Start planning to open up your businesses and get them open. Open the doors. We have a lot to do. A lot to do. Listen, we're going to make it through this. But it's going to take every single one of us to make sure that we choose good people, better people, to lead in our governments. Right now, we just don't have it. We need to do better. Listen, if you have any questions or insight or comments, send me a text at 818-252-5682. If you are in conflict or you need mediation, if you have a dispute going on, contact me. Send me a text at 818-252-5682. I'm a certified mediator, and I can help you. Let's go out today, everybody. Have a great Memorial Day weekend. God bless every single one of you. I'll talk with you soon.
Thank you for listening to the WBT with Michael Lodge. Join us again tomorrow as we explore more about business and taxes. Follow us on iHeartRadio and go to our podcast website at www.wbtpod.com and listen to all of our podcasts and read our blogs.
This podcast has been produced by Michael Lodge, fully focused on content.